Great. Well, thank you to everyone for being here. My name is Eric Colchimero. I am the Director of Government Affairs for the Alzheimer's Association in Maryland. And I want to welcome you to the next in our series of Maryland Advocacy Week conversations. This is our annual event, virtual again as a result of the pandemic. And thank you to everyone who has taken the time to join. And thank you to our guest today, Stevanne Ellis. Stevanne serves as the State Long-Term Care Ombudswoman. And before I go any further, I want to turn it over to our regional lead for the Alzheimer's Association, Kate Rupert, to make some opening remarks.
Thank you, Eric. And I have to say, when I look at this picture on the left-hand side of my screen, it warms my heart to think about back to the days when we'll all be back in person. I just want to thank everyone who's attending today's session, and really just start off with a special thank you to Stevanne for her incredible work. As we know, during the pandemic, especially those who are living in long-term care facilities and nursing homes have been disproportionately impacted by the pandemic. And your tireless work, and for those of us who are supporting families who are dealing with the diagnosis of dementia or Alzheimer's, we know this is a difficult time. So we appreciate all that you've continued to do, especially during these times, to fight for those people who are trying to navigate a difficult situation and provide them with hope. So we appreciate the partnership. And I know we were talking earlier about the Mutual Admiration Society here in the work that we both do. But we know, obviously from our latest facts and figures that 48% of those living in nursing homes have dementia, and 42% of those living in assisted living facilities have dementia as well. So the work that you're doing is truly incredible. And just on behalf of the Alzheimer's Association, I want to thank you for the partnership, for your years-long, well beyond this webinar, support of the work that we're doing. And I want to thank those who are joining us today. I know it's a busy week for all, and we talked about Zoom fatigue. But you being here, and I see a lot of familiar names in the chat as well, and being advocates and supporters, or if you're here just to ask questions, it really means that we're working together to change the trajectory of this disease for future generations. So thank you. And with that, I'm going to turn it back over to Eric.
Great. Well, thank you so much for the opening remarks, Kate, and thank you again to everyone who's here. So the way things will go today, I've asked Stevanne to make some opening remarks explaining a little bit about her job, what she does, and how it's worked during the pandemic. I will ask a couple of questions, and then throughout, and particularly at the end, please don't hesitate to put your questions in the chat box. If they are personal in nature, you are welcome to put them in Q&A, and I will not identify folks by name if you use the Q&A function. Or Stevanne, as I mentioned before, has already so warmly offered to answer your questions directly, and you're welcome to email her with questions and thoughts. So with that, I will turn it over to Stevanne to make some opening remarks and talk a little bit about her work.
Well, thank you all very much. And thank you so much for the warm welcome. And I'm so pleased to be here with everyone today. We were talking before we got started, it'd be nice to be together again. And I look forward to maybe next year we'll be able to do this in person. Last year, there was a panel of state ombudsmen, and one of the local ombudsmen spoke on my behalf. And that was very well received. So if you attended that last year, thank you for coming back again. And I'm so pleased to be here with you today. I'm the State Long-Term Care Ombudsman for Maryland. The way we're structured nationally is every state has somebody in my role. So there are 53 of us across the country, and we all have the same charge to advocate for residents of long-term care. In Maryland, that is assisted living and nursing home settings. In other states, it's also home and community-based programs, as well as other type of provider types. And by the way, we're very well connected to each other across the country. So if you need an ombudsman in another state, feel free to reach out to me about that or anything else. My contact information is in the chat. You're welcome to call, email me anytime, and I will get back to you. If for some reason I don't respond, please, there's an alternate on my voicemail. There's always a phone number of someone to call. So if I don't return your call or email, please reach out to that person and they'll make sure that I respond to your concerns. Because if you take the time to reach out to me, I want to make sure that I respond to you. It's very important. So our program is the advocacy program for nursing home and assisted living residents, as I mentioned. And the way we're structured in Maryland specifically is we have a state office where I work, which is, if you're looking at me, the background behind me, I'm in my office today. I have 2 other staff members that I work with here in the state office, an ombudsman specialist and an administrative person. And we oversee the program as a whole for the state of Maryland. We have 19 local offices, one that covers every county on the Eastern Shore. There are 3 offices that cover the entire Eastern Shore. So 2 of those offices have multiple counties. Queen Anne's County has their own ombudsman. And then in the western part of the state, on this side of the bridge, every county has an ombudsman program in each of the counties. And that is how we're structured. We have at least 1 employed ombudsman in every county. And we also have volunteers. And the way that our program is structured is that the training and the certification is the same for both. We get our authority from state and federal law. And the federal law is called the Older Americans Act. And it has very specific regulations that require very robust and rigorous training that our staff have to go through. And it includes an initial training and an orientation and continuing education after the fact that everyone has to stay current. And if you've met one ombudsman, you will notice hopefully that the training is consistent across the state if you meet another. And we also have national training standards because our program is a federal program as well as a state program, and there should be continuity across state lines. So if you've worked with other ombudsmen in other states, you should see that we are very similar in what we do and how we approach things. We do advocate for all things, so we can get concerns about anything from food to care to information, lack of information, communication, and I'll talk a little bit later about what we've been seeing pre-pandemic versus post. And we're not post-pandemic. I'll just say whatever this time period we're in now, it fits pretty well with what we've been seeing throughout the pandemic for the last couple of years. So prior to the pandemic, what did we do? We went out to facilities on a regular basis. So we tried to visit nursing homes once a month, just to visit, to get to know residents, to see how they're doing, to find out what life is like in the facilities, to let them know that we're there for them. By the way, our services are confidential. So if you talk to me about something, I am not allowed to share with anyone. So we're a good, safe place for people to talk. And that's really important for residents that live in facilities because sometimes they're reluctant to share things with us. And so we work really hard on the visits to build relationships with residents and families and staff, because we want to have a good working relationship with the staff in the facilities for lots and lots of reasons. But primarily, if a resident has a concern, we want to be able to talk to the staff about it. So having that relationship on both sides is critical. And we work really hard at that relationship building. We, in addition to doing those regular visits, we handle complaints. So as I mentioned, we have all kinds of concerns. Anybody can make a complaint about anything, and we address whatever concern they have. The neat thing about our program that makes it unique, it's about satisfaction for the resident. So what does the resident want? So if the resident wants food prepared in a certain way, their care to be delivered in a certain way, they want therapy, they want to see their doctor, they want medical records, they want to have their care given timely. That's what we advocate for. And we ask them specifically, what would you like? How would you like us to approach it? Would you like to do this together? Would you like us to coach you and then you go take care of it and let us know what happens? Or would you like us to do this on your behalf? My preference is to empower people to try to take care of things first if possible. But sometimes they want to do things with us. And then sometimes people will say, no, I really like you to do it for me and then get back to me. So we take all approaches, but it's resident driven, it's person centered. When a resident can't decide, then we go to what's legally called in our regulations, resident representative. So they're legal representative. If the resident can't give us guidance and direction on a particular thing, then we would go to whoever the most appropriate legal representative for that person would be. So we work a lot with families and power of attorneys and healthcare agents and guardians, but we always go to see the resident first. And we tell families, we're going to go see your son, daughter, husband, whoever, and we go from there. So that's what we do. And we really do want to get the resolution that they want, because for however long they're in the nursing home or assisted living, it's their home. Even if they're there for rehab, And it's very hard for people. If you've ever gone and received care, if you've ever been in the hospital, if you've ever been in a facility, you know how difficult it is to put yourself in someone else's hands. And so we recognize that, and we want people to feel comfortable and to get care the way they want. And that is really one of our missions in life. If we can't get the resolution they want, then we let them know other options. And a lot of time I'm on the phone with people talking to them. You can also do these things. And if anybody has any questions about other types of things we suggest, I'm happy to talk about that later on. So prior to the pandemic, we also did training with staff. We did things like what I'm doing right now with you all, talk to the public, and a lot of those things continued after the pandemic happened. So unfortunately, March of 2020, when things really started, we found out more about COVID and we realized that we needed to pull back. And so we stopped going out to facilities for a while. And we did a lot of activity virtually. And by the way, because we're a national program with the state ombudsman in every state, all of us across the country got together, and we still get together often. We meet usually 2 to 4 times a month minimum, and as needed with each other to talk about things, especially during the pandemic. We were meeting more often. Prior, we were meeting weekly, and sometimes more often than that across the country, because we really wanted to make sure. We'd never been through a pandemic before. There wasn't an ombudsman program at the turn of the 20th century when the last pandemic was. So we really wanted to make sure we were being responsive. And so across the country, we still continue to approach our program the same way. So when I'm trying to figure out how to direct my program, I go to my peers in other states and I say, how are you all handling this? And that's what I did for Maryland, because I wanted to make sure we were the best advocacy program possible for residents. That's what it's all about. So we did that. We did a lot of work virtually. We were doing a lot of phone calls, a lot of virtual meetings. We did a lot of Zoom. We're still doing a lot of Zoom, but we did a lot of that. And then gradually we started going back in towards the summer and the fall of 2020. And then definitely last year, we started going back in. And now we're visiting like we did before, with the exception that we have infection control training that we didn't have before. Our training is done by the epidemiologist at the state of Maryland that also trains the providers. So if you know providers that work in long-term care, if you're a provider yourself, you know there are provider calls a couple times a month. And the people that lead those calls are the people that trained us. They're the experts in public health and COVID in the state of Maryland. And so we got the training from the best. And I have a deal with them that if anything changes, that we need to do our training differently. If we need to wear some other different kind of equipment, PPE, and for those of you that can see me, I'm waving a mask, whatever it is we need to do, that they're instructing us and keeping us informed, because we want to be safe, but most importantly, we want the residents to be safe. It's just as important as keeping us safe. And we've done that. And we've been very successful in promoting, by example, the appropriate use of infection control, PPE and hand sanitizer and anything else that is needed to protect us and to protect the residents and protect the facilities. So we've been doing that. Our complaints prior to the pandemic were really our number one complaint for a long time, and is still our big complaint, is discharge. Anything related to discharge from the facility. So, and this is for assisted livings too. So not just nursing homes. So bad discharge planning, poor discharge planning, not sending somebody to an appropriate place, issues with finances, all sorts of things. Anything related to discharge, it's just been our number one complaint, and it's nationally has been as well. We've always had complaints about care. Thankfully, our abuse numbers are nice and low. So that's good. We have too many. One is too many, but abuse typically has not risen to the top of our complaint list, as some people might think. So I'm thankful for that. But most of our care concerns, they've changed a little bit, but we have a lot of the same kinds of concerns we did about choice, about call bell response time. The thing we've noticed that really has increased, and still not our number one complaint, but has increased, are issues related to visitation. So if you weren't aware, residents in long-term care did not receive visitors for quite a while because of COVID. And so can you imagine, you live in a facility and you can't see your favorite person in person. And can you imagine if you're a family member, which probably many of you have been, and I don't know if you've had anybody in long-term care, but can you imagine not being able to see your spouse, your significant other, your sister, brother, child who has dementia, or it's just awful. And so we had a lot of complaints about, well, I want to see my loved one. I want to talk to them on the phone. I want to touch them. And so lots and lots of things happened during the pandemic related to that. Now visitation is allowed in nursing homes, assisted livings, and I'm happy if anybody wants specific information about guidance that's current as of right now, email me, call me, I can send it to you. It changes all the time. So what is current now may not have been current 2 weeks ago. So just keep in mind, what if you've gotten guidance in the past about nursing homes, assisted living, and actually even COVID, it changes. So make sure that when you look at, my personal advice to you is make sure when you look at guidance about anything related to COVID and to nursing homes, assisted living, make sure it's current as of today, February 15th at 10:22 in the morning, because it could change. So that's, that's in normal times prior to the pandemic, guidance lived for a long time. It didn't change very often. We weren't sharing information about the CDC, Centers for Disease Control, and these other agencies very much. But a lot of what we've done since the pandemic is sharing lots of information, dispelling myths. That's a big part of what we've been doing as well. People say, well, the facility is saying that we should do such and such. Well, sometimes the facility is right. They're right. You should be doing such and such. Other times the facility, I'm not sure what guidance they were reading. It wasn't what we shared, or it was a different interpretation of it. So I'm a big believer in giving people the guidance and helping people with it. So if you're somebody that would like that information, feel free to reach out to me. So we've done a lot of education. We've done a lot of work on visitation. We've done a lot of work on communication, because a lot of early issues in the pandemic, and still at times, is getting through to somebody to have concerns or questions asked, or even to get through to your loved ones. And so we have had a lot of complaints about just communication in general. A lot of times they're easy fixes. Somebody didn't get call the right number, somebody called and left a message, somebody didn't get it. So sometimes it's just an easy fix. Sometimes it's a more serious problem that's an indication of one of the big things we've noticed, and this isn't shocking to most of you, unfortunately, is staffing in long-term care has been a huge problem. It was a problem before the pandemic, but because, as was mentioned at the beginning, the pandemic has taken the toll on healthcare providers. It's taken the toll on people in nursing homes and assisted livings. We've had more people die in nursing homes with COVID than pretty much any other setting. A higher percentage of folks, and then thankfully the numbers are starting to go down. So yay, that's good news. But we still have too many problems with COVID and too much death. And we have, and it is, I think the thing that's interesting about the pandemic, and not necessarily in a good way, it's exacerbated the problems we had before. So the problems we had with staffing have not gone away. They've gotten worse. The problems we've had with communication have not gone away. Often they've gotten worse. So we really are concerned about those kind of things. And then what's the root cause? What's the cause of the staffing issue? Well, it's a systemic cause. There's things in society that people aren't wanting to work with nursing home residents. People aren't wanting to work in hospitals. People aren't wanting to work in certain environments. And you all, I'm sure, have seen this on the news. So there's lots of us. In my role as a state ombudsman, one of the things I try to do is fix problems. I work with Eric and other folks at the Alzheimer's Association to do just that. We look at why is this happening and what can we do to fix it? So that's the systems issue. So looking at staffing and workforce issues and things like that, what can be done to help? So if anybody has any ideas and would like to talk about that at some point, I'm all ears. I don't assume that I've thought of something you've been thinking about, because then I can take it to others that are trying to solve this problem. In our program, we look at the big picture, but we look at the little picture first. What is that resident going through? What can we do to help resolve that problem? What we're not willing to accept that you just have to wait for care. No, I'm sorry. I know there's a staffing crisis, but if that person needs help, they shouldn't have to wait for an hour. And we're hearing that a lot right now. People are having to wait a long time. So we're not willing to accept that. And I'm sympathetic with the staffing crisis. And I know it's a big problem, but if you're in a facility, you're supposed to get good care. The other thing I wanted to say is that for folks with dementia, it's always harder for folks with dementia in facilities. We know this because their perception of the world is different because of dementia. And providing consistency and continuity is really important to help with that. Well, the COVID threw the world upside down, topsy-turvy, and it has made care very difficult for the residents and the families. You know, people with dementia sometimes don't know they're supposed to wear a mask. They don't recognize the person. You know, you see me coming, you know who I am, you know, and if I'm your trusted person and you don't recognize me with this on, it can make giving care very difficult. It might be scary for somebody that doesn't recognize. So there's been a lot of work done for dementia residents and other residents with cognitive issues and mental health issues to help people adjust as much as possible to the change in the way care has been delivered. And, you know, unfortunately, we've learned a lot because of this experience. And I say unfortunately because I wish we hadn't had this experience, but I think the thing that will come out of it, hopefully that'll be a positive thing, is what can we do better? What should we have done before to anticipate all of the COVID-related things that have happened? And I think for folks with dementia, really looking at how care is provided and providing things in a person-centered way has always been critical, but this has shown that it's even more critical than ever. And so we're really advocating for that with people when we meet with them. But we work a lot we go out to facilities as often as possible, to both nursing homes and assisted livings. And we really want to help facilities as they deal with these crises. And I'm meaning, you know, staffing issues and you know, concerns and trying to figure, how do I help a resident when I'm trying to figure out how to staff the building? And so we talk with providers about these kind of things all the time. I wanted to give you all some information. I know there's questions in the chat, so I'm going to leave plenty of time for us to ask, but I want to give a little education information. And my goodness, that looks like a big jumble of stuff, doesn't it? So I wanted to tell you what the links that I just put in the chat are, because some of you may be interested in this. Some of you may be so sick of talking about COVID, you may not want to look at these links, but I wanted to point out a couple of things I think will be helpful. The first link, and you can see where the beginning of the link is by HTTPS, is the Department of Aging webpage. And I work within the Department of Aging. My office, the Office of the State Long-Term Care Ombudsman, is an office within the Department of Aging. So I wanted you to see all the services that the agency has to offer, because we have a lot of services, including my program. But the other cool thing that we've been doing since the pandemic is we have this sort of scrolling screen that shows things. And the next thing it shows is it has the information about COVID and the vaccine information for the state. So I encourage you to look at that if you're interested. It has information about how to get vaccines and boosters, and also the numbers in facilities across the state. So I wanted you to have that as a reference. The next link, coronavirus.maryland.gov, is information about tons of things about numbers related to facilities, related to transmittals that have come out. Pretty much everything you need to know that's been issued by the state of Maryland related to COVID is there on that website. And then the last thing is for nursing homes specifically, there's a reference called Medicare.gov. And it's where you can find all your Medicare information. By the way, you can also talk to the Department of Aging. They have a program called State Health Insurance Program. I encourage people that are mystified by Medicare, like I am, to call the State Health Insurance Program, get your questions answered. But Medicare oversees nursing homes, and the Office of Healthcare Quality that licenses and certifies nursing homes acts because of CMS, says they're the agency that does that. So I just wanted to make that connection. It's about money and oversight. And this reference, if you go to Medicare.gov and Nursing Home Compare, you can look up any nursing home in the state of Maryland, and actually most nursing homes in the country, and you can look up all kinds of information that's public data, including vaccination rates that they have to report both to the state and to the federal government on a regular basis. And outbreaks are reported as well. So even booster information is on there. If you're interested in getting emails and things like that, you can get on listservs to get updates about all of these things as things are added. but I wanted you to see that, that it's there for you as a resource. So I'd like to pause here for a moment. And Eric, if you want to ask me any of the questions from the chat or some things you wanted to know, and if I missed something you think would be, worth me sharing with the group, I want to make sure that I covered everything that would be helpful.
Great. Thank you so much, Stevanne. So we do have a number of questions in the chat box. What I think I'll do is I have a few things as well that are on my mind that I think might interest folks, but I want to start with our advocates because it's really their session. So I'm going to scroll up in the chat box and see the first one to come in.
Oh, thank you, Gary.
And the first question was a good 20 minutes ago. My goodness, love the excitement. And it's from Michael. Michael asks, Stevanne, do you help people who are not in an assisted living?
Well, so if you have a specific question, please email me or call me. So the answer is, so we're the program for nursing home and assisted living residents. However, people call us and say, I'm trying to I'm planning for the future. And I want to talk to you about how long-term care works and alternatives to long-term care. So I do talk to people about those sorts of things. I typically also point people to other agencies if they need more detailed information. So if it's more appropriate that the question isn't for me and it should go to the Department of Aging or to another agency, I'm happy to do that because I work really hard not to give people incorrect information. That's a big waste of your time, send you down the wrong road. But sometimes people have called other agencies and even called my own agency, and maybe they haven't gotten a call back quick enough for them and they get frustrated. And so I've had people call me because they just don't know where else to go. So if you're not sure who to go to and you think I might know, and it's sort of aging related indirectly, or Department of Social Services or licensing, and you've reached out to them and you haven't gotten the answers, or you've gone to the website and you're like, I don't even know where to start, you're welcome to reach out to me. I've been an ombudsman for, my goodness, let me think about this for a second. I think about 17 years. I've been a social worker the other part of my career. So pushing about almost 30 years of doing work, mostly in Maryland. I was in Texas briefly for a little while too. But I'm happy to help connect you with resources, but I am also the first person to say, I don't know, I need to check on that for you. The other thing I tell people all the time is if you reach out to someone and we talk about it and you don't hear back from them, reach back out to me again. I don't want you to run into a brick wall, because most of the time when people reach out to me, they really need something and they're stressed and frustrated, and sometimes they're not, but often they are. And so I want to help you if I can. So feel free to reach out to me. And by the way, one of the big questions along those lines is, do you guys advocate for people in independent living and continuing care retirement communities? We don't, because the idea is that, you're an independent person and you don't necessarily need us yet, but sometimes people do want to talk to us anyway, and I'm happy to talk to you and help you figure out. Senior apartments is another question I get. Who advocates for us in senior apartments? Well, there's really not an advocate, because the idea is, it's kind of like me. You're supposed to be like me in my own home. In theory, I don't need an advocate. I live in a house and it's not licensed. It's just my house. So that's the idea behind it. If you're an independent living, you're not really necessarily supposed to need an advocate, but sometimes you do. So I understand. Feel free to reach out to me. I often, by the way, send people to legal services, different legal resources, and give people a list of all kinds of things. So a lot of times I'm doing that. So feel free to reach out to me. That's the answer.
I'm actually there are a lot of advocate questions coming in, so I'm going to actually stick with another advocate question here before going to one of mine. And that's from Gary. Stevanne, Gary asks, is your visit predetermined and announced to the facility?
No. So we do unannounced visits as much as possible. And not necessarily that there's a need to do that, but sometimes there is. Sometimes we don't want them to know we're coming. Sometimes it doesn't matter. The only time it really is announced is if we have a scheduled meeting. Often we'll have meetings with staff, care plan meetings to follow up on concerns. Residents and families will want us to come. And sometimes because of the nature of who's attending those meetings, they'll know we're coming. but most of our meetings, our regular visits to facilities, most of the time are unannounced. By the way, we also attend resident and family council meetings if we're invited. So those are meetings where residents advocate for their situation and families also. By the way, if you're interested in what those meetings, the nitty gritty of that, reach out to me as too. It's a great way for a group of people to advocate and to ask questions and to get education and things like that.
And folks, please keep putting your questions in the chat box if you're comfortable. As I mentioned, you're welcome to also put it in the Q&A if you'd like me to say it anonymously, or as Stevanne has offered, please, if you do not want your question asked publicly, please feel free to email her. And as she mentioned, she keeps things confidential. Gary sneaks in one more question for you, Stevanne, here. Do you have any involvement in the review and evaluation of the facility itself? And let me just add to that. As you mentioned, there's an Office of Healthcare Quality that does inspections. I think kind of part of Gary's question here is, if you see a violation, do you refer it over to the Office of Healthcare Quality? What's your kind of relationship there with how the 220 plus nursing homes and the over 1,700 assisted living facilities are inspected, evaluated, surveyed, etc.?
So there's a lot of information about this. So if you need more, if I don't sufficiently answer, just get in touch with me. But the way it works is that we are privy to know at times when surveys are happening prior to them happening. So survey basically is an inspection done by the Office of Healthcare Quality. And if we know ahead of time, then we'll talk to the surveyors, the staff at Office of Healthcare Quality, and we'll say, hey, we have these things you might want to look at. We're consent driven with them too, which means that if Eric has a concern, I can't share it with OHCQ, the Office of Healthcare Quality, unless he says it's okay for me to do so. There are some things that I can talk about without needing consent, things that are sort of global. So for instance, if there's rats in the building or insects, or the temperature of the building is too cold, or there hasn't been staff in the building, or things like that that aren't specific to a person, they kind of affect everybody globally. So I can share those things and not need consent. And by the way, I'm a big advocate of trying to work things out with the facility first, but I have told Office of Healthcare Quality things to have them look at. It just kind of depends on the situation. And by the way, I tell the providers this too. I'm pretty transparent in how I do my work and how I teach my staff to do this work. I tell them that, explain. It's a good idea to explain when you reach out to licensing and why you might do that, even if you're already talking to the facility. And then often, especially in nursing homes have different regulation and laws that govern them as opposed to assisted living. And there's certain things that we're involved in by law with nursing homes that we're not with assisted living. So we're often included in what they call an exit meeting, which is the last meeting before they leave, or sometimes they'll get in touch with us after the fact. And so, yes, we do give input into inspections in both nursing homes and assisted livings. And again, we also, when we make complaints to either agent, about either setting, to Office of Healthcare Quality, if a family member or resident does, and we know about it and can talk to OHCQ about it, then we will talk to OHCQ about those complaints too.
Great. I want to chime in with a question of my own here, actually tying it to Advocacy Week, because Stevanne, as you are aware, the Alzheimer's Association, with thanks to our bill sponsor, Delegate Bel Castro and Senator Bidel, has put forward legislation to specifically look at Maryland's small assisted living facilities and the quality of care they provide in the smaller facilities. And for folks who aren't aware, Maryland has right around 1,700 assisted living facilities, and roughly 3/4 of them are 9 or fewer beds, which is a very small number. So the question to you, Stevanne, is the Alzheimer's Association doesn't know the answer about the quality of care they provide, but can you offer some thoughts about your experiences going into some, and again, just broader thoughts about going into some of these smaller providers and things that you think are specific and you've experienced when going into the smaller assisted living providers with 5 beds, with 4 beds, with 6 beds. And there are, as I said, quite a number of them. I'm interested to hear your thoughts about what you've seen broadly, without identifying a facility by name, of course, and if there are any broader trends that you think are prevalent in those facilities.
Oh, goodness. So, by the way, there are lots of facilities that give very good care. So I don't want you all to think that I think facilities are bad or not, because it's not true. I think most facilities actually do the best they can, or they try to do the best they can. So I just want to say that on the outset. So if you've seen one assisted living facility, you've seen one assisted living facility, even though they're, the definition is they're supposed to provide care for two or more unrelated people that need assistance with activities of daily living. So dressing, bathing, grooming. There's a medical reason that people need assistance with activities of daily living. So this is the population that they're serving. And whether it's a little facility like Eric's describing, or one of the big facilities that provide care for more than 100 people. In small assisted livings, you will see usually a caregiver who is not licensed, and a manager who has training but also is not licensed. At this point, by the way, there's a bill about assisted living managers getting a license. So if you're interested in legislation and you want information about the study that Eric's talking about, or this bill about assisted living managers, let us know. We're happy to share that information with you. But so usually the caregiver does everything in these little places. And by the way, this is general. So if you're assisted living, or some assisted living, your experience is different, it could be. But typically a small facility looks like someone's home most times, and it could be in your neighborhood and you may not even know, because there's not necessarily a sign in the yard. It could be in a regular house like my house, and people share rooms with each other. Sometimes they have their own bedrooms. The kitchen is like your kitchen in your house. It's not an industrial kitchen. It's a regular kitchen like in your house. And that caregiver does everything: the laundry, the cooking, the housekeeping, the care for the resident. And the assisted living manager is the one that oversees it. Sometimes that caregiver is also the med tech. That is the one person that has to be on site that's licensed, and that med tech has to be there every day because people need medication every day. And those people in assisted living take more than one medication. And by the way, I'm interested to see if this study bill does pass, which I'm going to support the bill. By the way, one of the things I do in my job is I support legislation as the state ombudsman. And so this is one of the bills that I'm going to support, because I think we need a study. We've never had a study about assisted living of this size before, and there's not a lot of public information about assisted living for smaller ones. But the care it depends on the facility. Some facilities do great care, and they take care of the person from when they come in and need a little bit of help until they need a lot of help, and they stay there throughout the rest of their life. Other places, the care has not been so good. I would say Maryland is pretty, we have a bell curve. Most facilities do a pretty good job, but we have outliers. We have some places that are just the best places ever. By the way, I can't recommend, so I can't tell you that's the best place ever, or, oh my God, don't go there. I can't say those things. We have some places that are awful. And but most places are pretty good. And we want to visit, we try our best to visit assisted livings as often as we can. Because we have so many, we don't get to some of them as often as we'd like to, because there's not enough of us. Oh, and by the way, with our volunteers, one of the reason we have volunteers is to increase our outreach to facilities, especially assisted livings, but to nursing homes too. Both populations are equally important to us. Eric, did I get at your question?
I believe you did. So I want to say thank you for that, and shift back to some of the advocate conversation questions. And the next one came in from Gary again. Can you provide an example or two about how you help a facility with staffing issues? This issue is prevalent throughout all industries since the pandemic began.
Yeah, so one of the things that we do is we talk about again, we're consent driven. So if a resident has told us about concerns they have, and it looks like it's related to staffing, and honestly, most of the complaints are, it's either the staff's ability to, these days, it's, about how fast care can be given, how long people have to wait, and all the things, spending enough time with people, not rushing people, all that. So what we do is if we have a concern about staffing, we see who we can share information specifically about. And then if we can't share specific information because the resident hasn't given us permission, then we talk globally about what we see. Well, we were in the hallway and we noticed that there were a lot of call bells on. And then this is easier done, it's more easily done in nursing homes, because nursing homes, you really can't address anonymous complaints. Small assisted living is tougher, because the resident, you have a 5-bed facility, 4 of the residents are confused. There's one alert and oriented person, and it's Eric. You know, Eric's the one that made the complaint, most likely. Not always, because we have people that are confused that can make very clear complaints, but people are going to assume it's Eric, because people make assumptions about folks with dementia that they don't have concerns. Well, they do. So, and sometimes they're just as happy as they can be, and they can tell you even though they're confused. I just want to let you know that we always give people the benefit of the doubt in our program. We don't assume that because you have a diagnosis of something, or you appear to have a diagnosis of something, that you are not able to communicate. We always go to the residents. So I just want to say that. So, but sometimes providers make the assumption, because Eric's the only cognitively intact person for the most part in this assisted living, that the complaint may have come from him. Well, it didn't come from him. It came from the other resident down the hall that knew she wasn't getting her call bells answered on time. So we want to resolve the individual complaints. And so we tell the provider, we talk to them about their staffing. We talk to them about what they're doing to hire. We talk to them, can they give a class? Can they have other staff do things? Like some facilities, and this was harder earlier in the pandemic, but having volunteers to come in and do some things. Obviously, you don't want a volunteer to come in and do something that's a clinical issue that they don't have the training to do, but looking at it outside the box, like what must be done? What's the current staffing that you have? What are you doing to hire? What are you doing to give incentives to hiring? What can you have other people help you with? Maybe the DON needs to get out of her office and walk down the hall and take care of people. Maybe the MDS nurse, and that's the minimum data set, that's the assessment that's done for nursing homes. Maybe that nurse needs to walk down the hall and help with care. So getting the people that have a license but have administrative staff recently, having them go out on the floor and do work. Some places have done all of that. And they come to us and like, Stevanne, I don't know what to do. So then, and then I reach out to Eric and other people I know, and I'm saying, I'm at a loss. I've worked with this facility, don't mention the facility name, and they're trying to figure out what to do. So I reach out to people that are going through the same issues and try to help them, and sometimes I, have suggestions and some not. But I've also told providers, if you're in a crisis and you are having issues with staffing and it's going to affect a certain wing, certain residents, be forthright with them and their families. Tell them you're struggling. Communicate. Tell them what you're doing. Don't just, because we have had some providers that they've done the best they could, but they haven't had enough staff in the building, and therefore people are having to wait. So be honest about it. And that's what we've encouraged people to do, because that's one, I tell you, that's been a big complaint from families, especially, but the residents too, that this provider has not been honest with me. And I call them and they won't call me back. And then they assume that means that they're hiding something from them. And this whole thing, I'm like, no, please. So the providers I know that have been very successful, and many of them have been, part of it has been because their communication has just been wonderful on websites, calls, Zoom meetings, email blast. And we suggest this a lot. So if a facility is having a problem, share information with everybody so that they see you're trying to fix it or what they're doing. So, yeah. And by the way, Eric and I are on a committee called the Nursing Home and Assisted Living Oversight Committee. It's the quality of care for nursing home and assisted livings. And so we talk a lot about systemic issues to try to figure out what can be done. And I talk with other people as well. What can we do? I talk with provider groups. I had a call with Leading Age not too long ago talking about what we could do to help with staffing across the state. So we all are trying to figure this out together.
Wow, really thoughtful. Thank you, Stevanne. Couple of questions that have come in the question and answer. And as promised, if folks want to put it in the Q&A in their chat box, I will mention them without identifying folks by name. First question, is it mandatory for nursing homes to keep and have public a book of concerns or problems?
So the answer is no. So the survey information from Office of Healthcare Quality is public information. it should be posted in the facility someplace where you don't have to ask for it. So it usually in a place that has a lobby, like a nursing home, it's usually in the lobby. It should be out on a table. It shouldn't be behind the receptionist desk where you have to ask for it. So that's the public information. Also, one of the things I put in the chat earlier, the nursing home compare, the survey data is also there. By the way, it is old, because one of the things that has happened, and this is what I mean by old, one thing that's happened because of the pandemic, the priority of what types of surveys, inspections that have been done at nursing homes have been dictated by the pandemic. Infection control surveys, really serious COVID kind of complaints, egregious things, abuse, serious care issues, and then everything else, including regular surveys. And so there have been regular inspections done throughout the pandemic, but they've been fewer than normal because of that. In assisted livings, the same kind of idea. Assisted livings also, there are surveys, they should put them out for people to look at them. I see it, and the problem with the ones that are in the small ones, like I described earlier in the houses, there's no lobby, there's a living room. So if you also can request the surveys, there's a Public Information Act, you can request surveys from Office of Healthcare Quality. My suggestion is, unless you really need one, I'd wait a little while, because the data breach that the Department of Health had, they're still kind of recovering from that, but you can still reach out to them, and I'm happy to put you in touch with whoever does that. There is a grievance process for both nursing homes and assisted livings, but grievances are private. So the person knows, and we might know about it, perhaps, maybe not, but if a facility makes a grievance, they don't put the book out on the counter. I'm sorry, if a resident or a family member makes a grievance, or a member of the public, that book is kept. Whoever is in charge of handling the grievances for the facility. And sometimes the facility also has complaints they look into, the things they have to monitor, like unwitnessed falls and unexplained events and some serious events, and that's all spelled out in regulation. So if you're interested in the nitty gritty of things and you want to know that kind of stuff, reach out to me. I can tell you what's required and where that lives in the law.
Another question coming in from the chat box, through Q&A. I may have missed it. Sorry, I got a phone call, but do you engage with assisted living providers that are 10 beds or less?
All of them, all 1,700 plus, whether they're 2 beds or 500. I think our largest provider, Maryland, is like 400 and something beds. I'd have to double check that, but yeah, no, we have the pleasure of being connected with all of them.
And thank you again for your description. You've been to many more providers than most of us, I believe, on this call have. And
lots of them. And
it was thoughtful to hear kind of your understanding and your experiences in these smaller ones. And to that end, Gary asks if there is anything in regulation or a qualification as a small assisted living facility. I think that doing some sort of survey is a great idea, and I would support legislation like that. Does that have a chance of passing through the chambers? I will take Gary's question and add one little pivot to it, Stevanne, to throw it your way. One of the things that this legislation, and I'll put the bill number in the chat box, looks at is the quality of care, of course. And the Maryland Healthcare Commission oversees the quality of care and reports out information of assisted living with 10 or more beds. Do you have any sense how that determination was made? And kind of where we go from here, why that 10 or more was made, both for the quality of care that's reported out by the statewide committee, and also one of the things this bill looks at is COVID data. And on the state's COVID dashboard, it's only the assisted living facilities with 10 or more that get publicly reported on that dashboard. How did we get to this 10 or more number?
To be honest with you, I don't know. I think I used to know why, but I could probably find out though, like what the history of why the MHCC just has the 10 or larger assisted livings. I don't know. It's been that way as long as I can remember. By the way, I was a local ombudsman too, for those of you that don't know me, for 8 years. So I've been here in the state office over 8. I was a local ombudsman for over 8. So I just want to say that. So that's part of the reason I actually was boots on the ground for many, many years doing this kind of work. I don't know. I mean, we have to wait and see. Study bills are interesting, and Eric probably has thoughts about them too, that sometimes there's great interest in them by both houses and the public, and other times not so much. I think there's a lot of interest. My personal opinion from talking to people is that there's a lot of interest in nursing homes and assisted livings for the first time in the last few years, which makes me sad in a way. I'm happy that's a positive outcome of the pandemic, but why did it take a pandemic for people to be interested in nursing homes and assisted livings? So I think the positive thing that's come out of the pandemic, because there are a couple, not much, but a couple. One of them is an interest in these 2 types of settings in Maryland and the bills that are associated with it. So my personal thought is I think some of these bills that might not have been passed before might be this time, but I don't know. We just have to wait and see. And then as far as the study goes, my guess is the reason that the study is focused on the smaller places is because there's not public information available about the smaller places like there is for the larger places.
My goodness, we are at 10:58, and I want to say thank you to Stevanne for taking the time. Thank you to everyone for all of these questions. Oh, we have one last one that we'll wrap up with, Stevanne, just to squeeze it in, because I see it for Irma, and Irma, I don't believe has asked a question yet. And that's to you, Stevanne, as we close. Are facilities required to let family members know if someone in their facility has COVID? And what is being done to protect our loved ones still living there?
So the answer is, if there's an outbreak, which means 1 or more people have COVID, that's staff and residents, they're supposed to let the families know. Now, the families that they let know are the ones that would normally get the information. So it's not all families, because some people have these lovely, huge families. But if any of you find that what I've said seems contrary to what you've heard, or you want more information, I'm hoping that if you've been talking to facilities, you're hearing the same thing that I've been talking about. But if you find that this is not the case for you, please reach out to me. And I can also, if you need copies of the transmittals that say what facilities you're supposed to share publicly, I'm happy to send that to you as well, the latest and greatest, because I want you to get good at, you all have enough to deal with in your life, I'm sure. You're here as part of the Alzheimer's Association, which means you're advocating for probably somebody with Alzheimer's or on behalf of the mission, or you're just interested in advocacy. So you have enough to think about. So if I can make your life easier by sharing information with you, I really do sincerely mean it. Please reach out to me. You can also reach out to my staff in the counties. You don't have to reach out to me directly. And I'm happy to, by the way, my name is Odd. So when you send me an email, make sure that my name is spelled correctly. And I'm not trying to be weird about that, but I have some people that send me emails and they'll add a letter, or they delete a letter. I really want to get your email address. So I always respond to emails. So from especially people that it requires a response from. So please, if you don't hear back from me, let me know, let Eric know. Believe me, Eric has no problem reaching out to me anytime, which is great. I have no problem reaching out to him anytime. It's a deal he and I have. So if you reach out to me and you're like, Stevanne didn't respond to me, well, tell Eric, because Eric will say, why didn't you respond to Irma? Like, I don't know. I didn't see the email from Irma. And so we want to make sure that you have what you need. That's my job. My job is to make sure if there's something I can help you with or get you information, I want to do my best. I'm not going to promise I'm going to be successful, but I will give it a good effort. And I really do mean that.
One last comment that I want to chime in with, which is from Gary, and it's can't say how great this presentation was. Very informative. I will be emailing you later.
Awesome. Thank you. By the way, you all are so kind. And Eric said the nicest thing in the paper about me too. I just wanted to tell you how nice Eric is to be so kind. You all have been so kind and such good questions. If you didn't ask anything because you just didn't, but if you think of something later, reach out to me. This is why I do these things. So thank you.
And before we close, I am going to just do, as promised at the start of this call, one of the things we're doing this year are our door busters. So for the first 5 attendees, we're pulling out a name out of the hat. I'm picking it out. And that person, as a little thank you for joining our event and for joining early, will receive an Alzheimer's Association fleece blanket. So I'm reaching into my bag, pulling out the name. And then first name that comes out is,
Very exciting.
If folks can read it, Kathy Siggins. So Kathy, you will be receiving an Alzheimer's Association fleece blanket as a thank you for your advocacy, a thank you for joining our Advocacy Week event early. And again, each of our morning conversations, including tomorrow morning with Suzanne's colleague, Deputy Secretary Bernice Hutchinson and Secretary Kramer, we'll be doing it again at the end of the presentation. Thank you everyone for joining, and a big thank you to Stevanne for all you do. As I said in the press release, you are, and your office and network of ombudsmen are heroes during this pandemic. The work you do to aid residents with Alzheimer's and dementia to navigate complex situations, we're grateful. So
Well,
thank you for all you do.
Thank you. And my staff are terrific. So I would be remiss if I didn't say how great and how privileged and lucky I am to have them. So most of what you hear about the program, it's all them, it's not me. So I'm very proud of them. And thank you all. Have a great day. I hope you continue to watch these advocacy events and reach out to me if you'd like to.
Have a great day. Thank you, everyone. And please don't hesitate to join tonight. County meetings by elected officials. You should have been received an email all about it. And don't hesitate to check our website, which we've been promoting a lot as well, which has the full event schedule. Thanks again, Stevanne. And thank you all.
Bye.